I mentioned earlier that calcium, potassium are very important to cardiac function because your heart is a muscle as well. It's very likely that while you're managing this malignant hyperthermia code situation, you also have a true code blue going on as well, heart arrhythmias or even cardiac arrest. So you may be having two separate code teams, if you will, working simultaneously on this patient. You may have your crash cart right there. Hopefully they're hooked up to the defibrillator in case you need it. So it's going to be a lot of people and a lot happening at once. Hopefully you get your patient back stable, and then they're going to go to ICU for monitoring. Depending on how severe the reaction is and any damage that was done, they may need to stay anywhere from 24 hours to 2 or 3 days. It just depends. There is always the risk of reoccurrence. You may get it under control and it may happen again, just because it really depends on how much anesthesia they've been exposed to. It is an important topic to be familiar with. Like I said, brush up on it from time to time because you never know when it's going to come across you. There is a test that is available for people if you're unsure that you're genetically predisposed to it. Maybe you've had some family members talk about abnormal reactions to surgery in the past. There is a test available where they do a muscle biopsy, take a little piece of your muscle tissue and expose it to the trigger. It's called a caffeine halothane contracture test. They'll take that muscle biopsy, expose it to the trigger, and it will contract and jump around like a little jelly bean if it's positive. So that would tell you if you are at very high risk of malignant hyperthermia if you have an upcoming surgery. For more information, you can go to Malignant Hyperthermia Association of the United States. They have a hotline that can be used. You can call it if this is ever happening to you in real time. You can call them. They will run you through the algorithm to make sure you're doing everything that you can for the patient. But if you have more questions about it, please feel free to shoot Eric a question or comment. And we appreciate you watching this video. Thanks.